my name is Alexis. Today I'm going to show you how to put an NG tube. So I already have went over my patient's medical records and I have gathered all my equipment, and now we're going into the room. Knock, knock, knock. Can I come in? Hi, Mrs. Jones. Can I see your ID band? Can you say your name and date of birth? Okay, thank you. I'm gonna do some hand hygiene. And so today we are going to be putting an NG tube in. It'll help with your nausea and you won't be vomiting anymore. It is kind of uncomfortable, but I'll make sure that you're not in too much pain. So now I'm putting gloves on. And I've already gathered all my equipment needed for this procedure. And it's not a sterile procedure, it's a clean one. Okay, so first thing I'm gonna do is measure.
When you secure it the second time, don't forget the skin barrier, because I know, like,
we measure down to the sternum. So it's about 60.
What is that? Oh, after
and
the
so,
first, like, lightly secure, checking.
now can you test which nostril you can breathe out of? And so she says that her left nostril is more breathable. So now we're going to take the NG tube and we're going to mark where I measured, which was 60. And now I'm going to take the tip of the NG tube and lubricate it about 1 to 2 inches. And if any topical anesthetics would be needed, I would have used those as well. So now, Mrs. Jones, I have your basin for you and a cup of water. If you could just lean your head back. I'm going to insert it. And I will know when it has reached the back of the throat because the patient will cough or gag. And at that moment, I would have Mrs. Jones lean her head forward and drink water. And as she drank, I would move it further, but I would stop when she would breathe.
Good? Alright, ready? 3, 2, 1.
And now I've reached my tape marker. And so now I'm going to take a piece of tape and secure it to the side of Mrs. Jones's face. And now I'm going to check to make sure it is in her stomach. And I will do that by removing the cap and taking a syringe and checking to see if there's stomach contents in the syringe. I'm looking for brown, yellow content. Okay, and she has stomach content in there, which meaning it is in the stomach. So next I'm going to measure the exposed tube.
Yeah, explain, assemble, curtains.
And I will document that into her chart. And so next I'm going to tape it around her. Well, I'm gonna remove this tape. I'm going to take a piece that's split in two. I'm going to wrap it around the tube so it secures in place. And then next, I'm going to be clamping the tube, removing the syringe, and capping it off because there's no suction needed. And I will be securing it to her gown. making sure that the tube is above the stomach. Okay, and now that the procedure is done, okay, so now I'm going to remove my gloves and perform some hand hygiene. And I have already made sure that Mrs. Jones is in a comfortable position, and I will be visiting her every 2 hours to help her with oral care.